observed, I wanted just to catch up quickly with our session of today morning. So this morning we had a very fruitful discussion on universal health coverage and the role of private sector, informal and formal sectors, the community beyond the regulatory system. It was also noted that holistic approach was the way to go. We also then discussed the need of restructuring healthcare system to accommodate not only communicable diseases, but also non-communicable diseases and neglected tropical diseases, to just cite few. Our take-home message that at least I got was that we need to work together. We need to consider social need, development, equity, and something that came up was the leadership as cornerstone, without leaving behind anyone. Our next item on the agenda is adolescent health. We will be honored to be joined by Her Excellency, the First Lady of Rwanda, Mrs. Jeannette Kagame. In a few minutes, she will arrive, and I will humbly request you to join me in welcoming the First Lady of Rwanda, Mrs. Jeannette Kagame. Thank you. So please be seated. And in a few minutes, we are going to receive her. As you have on the agenda, so we have our session on adolescent health. We will have different panelists. Half of the panelists are youth, young people. And half of our panelists are also young adults. So we are going to discuss about adolescent health and health related to adolescent, what we need to do in relation to SDG. Thank you. Hello, I'm just reminded that don't forget the translation. So channel 1 is English and channel 2 is French. Deuxième chaîne, c'est en français. Première chaîne, c'est en anglais. Merci beaucoup. There's no Portuguese, but I can try. Obrigado, yeah, I'm getting some help here. I don't know if you look at the agenda, so we have a small clip video that is going to be presented as well. So, and that's, if you look at the agenda, we have that, and then also we have our panel. So this session is a little special, where we are having both the panelists and the video going on. Please welcome Her Excellency, the First Lady of Republic of Rwanda, Mrs. Jeannette Kagame. Thank you. Your Excellency, gathered here are delegates from various sectors from different countries. We have here ministers, government officials, members of academia, members of civil society, health professionals, and young people. Your Excellency, today morning we spent discussing on universal health coverage and the holistic approach that puts everyone as key actor throughout the healthcare delivery system. We all agreed this morning that achieving SDGs will require the participation of not only the government, private sectors, community, including community health workers, formal and informal sectors, without leaving anyone behind. This afternoon, we'll discuss the adolescent health toward Sustainable Development Goals. Your Excellency, thank you again for being with us today. This is a testimony of your commitment to the noble cause of good health and development. Your Excellency, allow me to call upon Dr. Moeti, the Regional Director of WHO, to deliver her opening remarks, and later on, she will invite you, Your Excellency, to address to this audience. Dr. Moeti, welcome.
Your Excellency, the First Lady of the Republic of Rwanda, honorable ministers and members of government, representatives of UN agencies and international organizations, young people who have joined us here, ladies and gentlemen. I'd like to wish a very warm welcome to Mrs. Jeannette Kagame, the First Lady of Rwanda, and thank you sincerely, Excellency, for having graciously accepted to participate in this special session and to deliver the keynote address to ourselves and our young people. I'd like to welcome very warmly all the participants, especially the young people who are going to be in our panel, the young people who are filling up much of the room. A very special welcome to the moderator. I look forward to hearing your expert insights and views on how to stimulate actions to improve the health and well-being of young people as well as their development. This special event on adolescence comes at a critical time because we've recognized that improved adolescent health is key to achieving the Sustainable Development Goals and the objectives of the Global Strategy for Women's, Children's, and Adolescent Health. Up to now, in our work on health, on what we have been calling Through the Life course, we have somehow skipped the specific health and development needs of adolescents, and we've recognized that it's time to put more effort on this. There is a growing momentum to put adolescents at the heart of global health policies and strategies. We have recognized the multiple benefits that will accrue from this for adolescents now, when they are young, for their adult life, and for the next generation, because we will be building the parents and leaders of tomorrow. We also will leverage their capacity and their good health for economic development in the countries and on the continent. There is growing recognition that adolescence is the best time to target healthy behavior and risk prevention to protect the health of adolescents and avert unnecessary disease and death. We need to formulate goals for the healthy development of young people linked to sexual and reproductive health, to communicable diseases, to non-communicable diseases, including mental health. They play a strong role in outbreaks as well. We saw how young people were mobilized to support the Ebola response in West African countries. This is an opportunity for us to teach young people about healthy lifestyles, for young girls to learn the skills, to be confident, to be agents of their own health, for young men to learn about respectful relationships with women and address one of the drivers of ill health in our region. We can work with young people on effective preventive interventions and also work with them to ensure that they have better access to services when they need them. The impact of how health services are delivered for young people, adolescents, needs to be monitored and reviewed with the gaps and obstacles addressed directly. There is a huge potential, we have seen it in action, for adolescents as mobilizers, as leaders, as opinion shapers, as agents, as contributors, and indeed as caregivers. In the context of the transformation agenda of WHO in the African region, we have made adolescent health one of our flagship programs to make adolescents and young people the human face of universal health coverage and the Sustainable Development Goals. We think that if our health systems can deliver for an 11-year-old girl who lives in a village, in a poor household, and see her transition to a healthy, assertive 18-year-old, we will have succeeded in universal health coverage. So this program provides us with the opportunity to foster the implementation of evidence-based interventions to guide and support countries and work with partners to deliver interventions for the greatest number of adolescents. It provides opportunities for integration and for the delivery of quality services for and with adolescents. It will require joint actions, what we sometimes call a whole-of-government approach across different sectors such as education, trade, communication, water and sanitation, again, working with adolescents themselves, in line with the guidance on the Global Accelerated Action for the Health of Adolescents, which was launched at the World Health Assembly with Ministers of Health in May this year. We in WHO will work with our partners, particularly UNFPA, and I recognize the Regional Director for Eastern Southern Africa of UNFPA as one of the panelists, with UNICEF and others. And this is work that we will do to support country leadership, to foster collaborative partnerships, to foster joint actions, and to work with powerful change agents and champions to make sure our young people are healthier. Each entity can build upon our own comparative advantages to make a positive difference. So I look forward very much to stimulating discussions on how we can all work together with adolescents, for adolescent health, for us in WHO as part of our flagship program, and for all of us as part of the Sustainable Goals. I'm inspired by the leadership of the First Lady of Rwanda and your work, Your Excellency, in supporting young people and health and development in the country, as are doing other First Ladies. I quoted yesterday the work of the First Lady of Namibia. We really follow your leadership and look forward to it. And it's now my great pleasure and honor to call upon Her Excellency, the First Lady of Rwanda, to deliver her keynote address. Thank you.
Thank you, Dr. Moite. Honorable Ministers, Regional Directors of WHO, African Regional Office, and UNFPA Eastern and Southern Africa, members of the Diplomatic Corps and head of international organizations, representatives of government and civil society institutions, ladies and gentlemen, good afternoon. Allow me to start by expressing how honored I am to be part of this important session today as we come together as members of the years we have left to meet this SDG 3. It will be a pleasant one, and we'll encourage you to come back to discover more. Today's special event allows us to learn more about the Adolescent Health Flagship Program, which will be used to monitor the impact on health development in the region by the African Regional Office of the WHO through adequate mainstreaming with national adolescent health priorities. This first Africa Health Forum therefore provides us with another valuable opportunity as citizens of Africa who count on such great impact on their future. The past years have coordinated through the Ministry of Health with the support of DFID, is implemented by Imbuto Foundation in 10 districts and focuses on empowering these young girls with educational and health information pertinent to that critical pre-teenage years. Through weekly mentorship sessions held in safe spaces, these young girls interact with a young mentor who discusses with them about their sexual reproductive health, developing a culture of savings, entrepreneurship, and the importance of completing one's education. Our health programs targeting our young population also heavily rely on involving parents and it involves parents and the community through what we call parent-adolescent communication forums, which teach families to talk more openly about these sensitive topics with the support of a clearly explained manual. Distinguished guests, allow me to also share another approach realized together with the support of my sisters through the OAFLA, the Organization of African First Ladies Against HIV and AIDS. In 2016, the Continental All-In campaign, initiated by OAFLA in partnership with the Ministry of Health, was launched in Rwanda. This campaign was created to address HIV and AIDS epidemic among the youth, with programs that aim at the elimination of mother-to-child transmission, the EMTCT, of the virus but also fighting stigma and dismantling stereotypes associated with the disease. Through the All-In campaign, we also saw the youth playing an active role in preserving their well-being by taking full advantage of activities such as VCT and voluntary medical male circumcision in an effort to reduce new HIV infections among adolescents by the year 2020 and the AIDS epidemic for all by 2030. It's our hope that through time, such campaigns will further contribute to increase awareness and community mobilization to help our youth continue to make better informed decisions for the sake of their health and that of the future generations. Ladies and gentlemen, as I conclude my remarks, I would like to take this opportunity to thank once more all those who have contributed to the realization of this special WHO event, highlighting once more the importance of advancing the question of adolescent health, while emphasizing the power of public and private partnerships to achieve the Sustainable Development Goal 3 for good health and well-being. This occasion is a true evidence that if we all join hands, we can overcome health and developmental challenges affecting our countries, our continent, and beyond. Let us continue to empower our young generations by opening up to them about the lessons we learned over the years, but also by making sure they continue benefiting from what we did not have growing up. Whether it be an education system that include comprehensive sexual and reproductive health, information, the implementation of efficient and intuitive youth-friendly services via health institutions, but most importantly, by overcoming our uneasiness towards some aspect of our adolescent health, because ultimately we owe it to them to give them all the tools they need to fully thrive. I thank you for your kind attention and wish us all fruitful deliberation.
Thank you, Your Excellency. Allow me to introduce you to Ms. Paladi, who is a philanthropist and board member of Partnership for Maternal and Newborn, Child and Adolescent Health. I was surprised to see a vibrant moderator, a young people, a young vibrant young people who is really pushing for the agenda of adolescent health. Join me in welcoming Ms. Paladi.
The First Lady of Rwanda, Her Excellency Madame Kagame, and the Director of WHO Africa Regional Office, Dr. Matshidiso Moeti. Honorable Ministers, if you'd please allow me, in the interest of time, to say I stand on existing protocol. So, ladies and gentlemen, good morning. Great. I wanted to ensure that we're all together, so it means we're paying attention if we're all able to correct me. Now, I'd like to immediately call my panelists to the stage so that we may get this session started. And first and foremost, I'd like to call Mr. Sylvain Hira, who's a medical student, an activist, social entrepreneur, but also a member of the African Youth Advocacy Network on Population and Development. Thank you very much. I'd also like to call yet another amazing and enthusiastic young person, Mr. Patrick Mwesije, who's the team leader for the Uganda Youth and Adolescent Health Forum, also a member of the Afrian Network from Uganda. I'd like now to call our panelists, the young at heart, Dr. Felicis Zawaira, who is the director of Family and Reproductive Health Cluster with the World Health Organization, the Africa Regional Office. And last but not the least, once again, the young at heart, Dr. Julita Onabanjo, who is the UNFPA Regional Director for East and Southern Africa. Now, in perfect Pan-African but also youth style, I'd like you to welcome my panelists and also warmly open up the session with a resounding Viva slogan, which we use as young people in these kind of spaces to show Pan-Africanism but also solidarity. So if I say Viva Adolescents, Viva, you respond by saying Viva as well. So Viva Adolescents, Viva! Viva Adolescents, Viva! Fantastic. Now, every day in Africa, when the sun rises, a girl child is born and presents the hope for a new and better future. But also in Africa, every day when the sun sets, this girl child faces the risk of having her childhood robbed of her, either by going to FGM or being forced into child marriage, unless and until we do something as stakeholders and as decision makers. The whole point of this special session is to elicit the engagement of member states, partners, including young people, to contribute towards improving adolescent health and stimulating actions on adolescent health within the region of Africa. Also with the background of the global strategy on women's, children, and adolescent health, which aims at ensuring a future where every adolescent does not only survive, but they're able to thrive, transform, and fully realize their potential. Our panelists for this special event include a range of youth activists from the region, international experts operating in the area of health and development of adolescents. And for this event, each panelist will be given 3 minutes to first talk to the issues or the topic that they have been assigned, and then later on, hopefully, we will have time to take some questions from the floor. And may I please start off by saying, may you please be concise and stick to the time allocated. It'll be very unfortunate if I have to stop you, but still in the spirit of Pan-Africanism and efficiency, I will have to stop you if you go over the allocated 3 minutes. It is not a threat, it's motivation for you to reach to the main points when you begin your remarks. But before giving the floor to the panelists, Your Excellency, the First Lady of Rwanda and the Director for WHO Africa Regional Office, honorable ministers and distinguished guests, I would like to invite you to watch this short video that was prepared by WHO with young people. Enjoy. Thank you very much for that really empowering and absolutely powerful video featuring adolescents and young people in the continent. Now, there's an African proverb that says you cannot shave somebody's head in their absence. And it essentially means that if we're going to talk about young people and adolescents, they need to be part of the conversation and in the room. And this is how we are going to start our panel discussion today. I'm going to start with Sylvain, and I want you to develop your topic focused on prevention and promoting of healthy behaviors among young people. You have the floor. 3 minutes.
Thank you, Paradis. I'm honored to be on this panel. So there is a big difference between the past and the current generation. One of the biggest difference is the information, how we access the information, how accurate the information are, and also how fast the information is. So in the past time, to get the information, especially sensitive information like sexual and reproductive health, it was not such easy. You need to go to find someone, you need to go to study in a school or to read a book. But for the current generation, people who have smartphone, you only need to write some few words in Google, like what is the symptoms of gonorrhea. Then you see full amount of information. Taking an example of our country, in the culture, the role of educating young women about sexual and reproductive health was assumed by aunt, or les tantes en français. So aunt were the person who were focused to teach about sexual health. And even though there is no statistics or big data or longitudinal cohort studies, the oral source of information said that it worked. Few young women were pregnant, and also the effects of lack of reproductive health knowledge was few. But the next question should be, how can we mimic? How can we learn from the culture? Then we implement the solutions for the problem we have now. So with the currently rapidly growing world, everyone is busy. Personally, I don't even know my aunt. Even the moms are busy at work. So to be realistic, the system of aunt cannot be working. But the good news is we have ICT. So by using ICT, it's what we did in my organization with the help of the Imbuto Foundation and UNFPA. We try to mimic, to create a virtual aunt so that young people can come and access the information as they will access it from their aunt. Thank you very much.
Thank you very much, Sylvain, for that. Absolutely very important. We do live in the digital era, and it's important for us as young people to reflect on how we can use and harness this potential that technology brings in order to disseminate information and empower ourselves, because without the knowledge, we won't be able to make the right decisions for our lives, which moves me to you, Patrick. And I want you now to talk about the importance of engaging young people meaningfully in ensuring that young people are the ones who are driving the sustainable development agenda. How can that be done?
Thanks, Gigi, and viva to all the young people in the room and those who are young at heart. So in September 2015, world leaders adopted the 2030 Agenda for Sustainable Development. And this is a historic, forward-looking, and universal agenda that has the potential to lift millions from poverty, save and transform lives of billions of people, but also importantly, protect the planet. Now, the 17 Sustainable Development Goals have committed to leaving no one behind through improving the quality of education, decent work and economic growth, achieving good health, promoting gender equality and women's empowerment, and have also reaffirmed that the population, the citizens, are at the center of the SDGs. But importantly, adolescents and young people are one of the groups of the population that are most touched by each of the 17 Sustainable Development Goals. In fact, whether we are to achieve the 2030 Agenda will depend on how we meaningfully provide an opportunity or a space for young people to participate and engage in the process. And do you know why? Because young people are a key driving force for the sustainable development era. Today, our world is home to 1.2 billion young people aged between 10 to 19 years, and 89% of them live in the developing world, in most of the countries that we represent here. But unfortunately, majority of these young people are currently not thought of as central to development. They are sometimes badly served by development, and they have been left behind, neglected in several, sometimes global and national efforts. These numbers of young people, or the youth bulge, does not only position young people as key beneficiaries to the sustainable development agenda, but it also positions them as a key partner with a significant role to play in achieving the Sustainable Development Goals agenda. It is therefore crucial, and as I wind up, it is important to invest urgently in the education, health, livelihoods, and meaningful participation of young people. And in order to break the intergenerational cycle of poverty and build strong economic social base, it is necessary to build adolescent health, socio-economic assets, and invest in their meaningful participation as implementers and key decision makers in the Sustainable Development Agenda. Thank you.
Thank you very much. Very good time management as well, Patrick. Later on, I'm going to ask you to expand a bit on how, because I know that a lot of the time we talk about the what needs to be done, and we can all agree on many of these factors and the justification. But I think what now our leaders, from us as young people, want to hear is how they can go about that, because we as young people, we're saying we're not being engaged effectively. So now, later on, I want you to speak to our leaders. How can we be engaged in the Sustainable Development Agenda? Now, I'm going to move to Dr. Zawaira, and I want you to talk in just 3 minutes about the Adolescent Health Flagship Program of the WHO Africa Regional Office.
Thanks, Gigi. I think as the regional director in his speech already started off, showing us that the greatest portion of our population on this continent are young people. But if you want to picture this, in the 2 days that we have been here, we will have lost 3,000 of these highly energetic, highly skilled, highly motivated young people. And they will have died from reasons that are totally preventable. They will have died due to conflict. They will have died in childbirth, or they will have died in road traffic accidents or suicides. So whatever is affecting them is actually something that we can do something about. I will also want to say, in most governments, we have been running what we call maternal and child health programs, and forgotten that adolescents are neither big children or small adults. They are actually an entity in their own right that have their own specific needs. So we need to look at, if we make an impact on their health, we will make the greatest impact for us. Some of the things that happen in adolescence, the harmful behaviors, start at that age. We are seeing, for example, that HIV/AIDS is rising in adolescence, whereas it's going down in all the other groups. So something is happening here. They are having sexual intercourse whether we like it or not. They are having sexual intercourse which is unprotected. So the rise in HIV is ringing a bell, and it should ring a bell among us. We are also seeing adolescent obesity rising. In the assembly, we talked about how we can reduce childhood and adolescent obesity. We talked about alcohol and tobacco companies that are targeting our young people. So what is happening to them is something that needs all of us. And we look at the adolescent health platform as a nexus that will bring programs together. We are going to talk about HPV vaccination. We are going to talk about comprehensive sexuality education that the First Lady talked about. We are going to address NCDs and their risk factors. So this is a platform that will bring even ministries, not just health, but education and others across the table. But finally, we think this is for our self-preservation. We are not just doing it for the sake of doing it. This is the generation that is going to be there tomorrow. If they are not alive, we don't have an Africa. So that is the reason why we thought it necessary for us to have an adolescent flagship program.
Thank you very much, Dr. Zawira, for that. Indeed, as the SDGs note, the future is a 10-year-old today. And you did highlight a couple of social issues and challenges that are facing the 196 million adolescents in the continent. Now, I want to move to Dr. Julita, who's going to paint a much better picture of the promise or the opportunity that we have as Africa and Africans. So the World Bank has said that Africa has an opportunity to generate around economic growth, or rather GDP growth, of between 15 to 15% of GDP growth between 2011 and 2030 if we invest in young people. And this is known as a phenomenon called the demographic dividend. So everywhere we look on social media, TV, we see hashtag DD, hashtag demographic dividend. What is this demographic dividend?
Thank you, Gogo. And really, I'm most honored to be here, but also I'm very touched by the regional director's tribute to our executive director who passed away 3 weeks ago. And I think, you know, having listened to all that has been said, including what the regional director for WHO had put up in terms of the youthful population that Africa has and the potential that that allows us to really move forward in development. And in fact, the theme, putting people first, but putting young people first. So really, I think in terms of developing this theme, I'm not going to even spend 3 minutes because I think it has been developed. But what I do want to say is that economically, and that's why you referenced the World Bank, there is a sense that we can have a boost to economies of Africa if the right investments are placed, particularly looking at the working class population and the dependency ratio between what we have as a working class cohort and a dependency cohort. And indeed, Africa has one of the largest dependency cohorts. So if you look at our population structure, it is very much a pyramid this way, with a large base of dependent population groups that expect the working population. I think the benefit that we are now seeing is that if we can ensure that that dependency ratio is in a way managed, we can begin to open an opportunity for where the working class population, if healthy, if educated, if empowered, if they have the ability to actually find meaningful jobs, we can actually boost the economies of our country. And that's the quotation you made. But I'm not an economist, and I'm sure if I look around the room, there will be World Bank experts. What I am is a public health physician, and I'm a human rights activist. But most fundamentally, I'm a proponent for young people. And so what our proposition is for Africa is really the importance of investing in that youth population that we have. And we've put forward 3 areas of investment that are key. The first is education. And it's not sexual and reproductive health education per se, but it's just the need for Africa to go beyond enrollment to quality education, to education that matches the economic development that we're looking for the continent. And so that's our first E, the education that is matched, and that particularly also looks at the girl child and the education of the girl child. The second is what we've called empowerment. And we feel that very much fundamental to that empowerment is a healthy person. And that's where the health of adolescents and young people needs to be an investment. And I'm glad we're putting it in our investment case. And I think the third, and we know it, is because indeed employment and the empowerment that comes from being able to earn ensures that not only can we spur up development, but that we can make the right choices. And so that's our third E. And so those 3 E's form the proposition when we ask countries to invest in young people. We're here at a health conference, but indeed we feel a holistic investment in education, in empowerment in health, and in employment and entrepreneurship. And I'll come back to, because the First Lady kindly referenced a very innovative work we're doing with her foundation on the iAccelerators. So I'll
Thank
leave
you
it there
very
for
much.
now.
Yes, thank you very much, Dr. Julita, for that. I'm sure somebody, please go ahead. I'm sure somebody managed to pick that up and put it on Twitter. The 3 E's: education, empowerment, and employment as a way of harnessing the demographic dividend. Now, I'm going to just go to the floor to get maybe 2 or 3 questions. But first, I want to go back to Patrick. In just 1 minute, here is the scenario. You enter a building, you go to the elevator, you get inside the elevator, and it's going to take a minute for you to move from the first floor to the highest floor. And you're in that elevator with some of the most influential decision makers in Africa. You've got 1 minute to convince them to invest in you as a young person to be able to have a space in decision making. Your 1 minute begins now. You're in the elevator.
Thank you. 1, I'm a key driving force. And 2, I'm already doing something that if mentored, if supported, I can scale it up. Thank you.
Great. He didn't need the entire minute, but I certainly hope that one of the decision makers in that elevator was able to be moved and challenged to want to engage you in decision making. Now, I'm going to take 2 or 3 floor comments, perhaps from a young person. Wase? Yes, please go ahead. You've got just 1 minute to make your intervention.
Thank you, and thank you for giving me this opportunity to talk on behalf of the young people. Well, as the previous speakers have just spoken, we need these services to be available to young people. And I just wanted us to not forget that this is a 2-slots model where we have governments and partners taking role in all of this, but the young people as well have a role to play. So, which brings me to my 2 points of focus. The first point being that young people need to recognize and appreciate the services that are already provided to them. Take, for example, a country like Rwanda where we have systems and already structures in place. But the question is, are young people already aware of the existence of these services, and are we ready to take ownership of these services? My second point is, as African countries are transitioning to digitalization, we as young people are demanding for services that are void of judgment and discrimination of any kind from service providers. Well, there's a saying that people usually say that behind every man's success, there's a woman. But today, I'm saying that behind every nation's development, there's young people.
Excellent point to end on, Owasa. Thank you very much for that. And perhaps maybe now a man, a gentleman, just in 1 minute, I can see hands at the back. Please pick any, or whoever is closest to you with the Robbie mic. Yes, yes, go ahead, please. It's not working. Is there anybody else with a Robbie mic that's working? Please go ahead, a minister from Togo, or Ghana, rather. Thank you.
OK. Je vais m'exprimer en français.
I think you've made yourself clear. Dr. Julita, you got that. Yes. Please.
Well, yes, I think you raised the right question, because indeed we have not only a momentum in terms of young people, but the possibility that that momentum will continue. And therefore, what is really fundamental is how we plan our institutions to actually absorb and to deliver for those young people. And that's why we call for the right investments. Because indeed, until you invest first and foremost in actually understanding that population profile, and that's one of the things, if I have to advise government as the first step, is really to understand what their population structures are, what the profile is, how fast their populations are growing, what is that fertility. A lot of our population growth is actually driven by adolescent fertility. But because we don't disaggregate that data well, many times the data systems don't even help us fine-tune what that is. And once we have that, we need to ensure that as governments develop their development plans, as sectors look at their policies and programs, that they take that into account in terms of moving forward. And indeed, that's what the Africa Union and our heads of states have actually said in their roadmap to harnessing the demographic dividend. How can we understand our population profiles? How can we project that in planning? And how can we actually invest the right resources, whether it's capacity, it's funding, to make that happen?
Thank you very much. I can see that Honorable Minister from Ghana is not satisfied with the response, but I believe there'll be an opportunity to engage after this. Now, we have unfortunately run out of time for this session because we do have a closing session after this, but I'd like to say thank you very much to my panelists, and I just to leave you with 3 key messages that are coming from the session. The first thing is that often we ask, what can we do for young people? But very rarely do we ask, what can we do with young people? So we need to start asking what we can do with young people. Second thing, closely related to what Nadesh was saying, is that also us as young people, we want space. But I always say that as a young person, if you're not given space at the decision-making table, you need to dress comfortably to sit on the floor so that no matter what, you are in that room and you are engaged. And then the last point on data, it is very important for us as Africa to reflect on how we're going to fill in the data gaps if we're going to address adolescent health challenges. There is a saying that in God we trust, in programming we need data. So thank you very much, and we'll be moving now to a photo session, and I'll take it back to Dr. Kondo to direct that. Viva everybody, viva! Yeah.
Nancy, honorable ministers, distinguished guests and delegates, please join me again in giving a round of applause to the moderator, Gigi, is that? And the panelists. So my task this afternoon was simple. First was to do the introduction, and second is to do the summary. So I think I'm already on my second task. So the summary, again, Paladi said it very well. I think the key message here is we should use adolescent as an investment platform for our future and educated and healthy generation. Thank you so much. Your Excellency, the First Lady of Republic of Rwanda, the regional directors, ministers, head of delegation, senior management from Afro, the panelists, and the moderator of the session. Please join me outside for a group photo, and we'll continue with our second session, which will be announced very soon by my colleague. Yeah, I think I deserve also that round of applause. Thank you.
I was going to say exactly that may we give Dr. Janine a round of applause and to thank the panelists. As the distinguished delegates are going out of the room for a group photo, I would just kindly ask everybody to remain seated for a few minutes whilst the honorable ministers and Her Excellency the First Lady are going out for a group photo. Thank you very much, distinguished delegates. We will just wait for a few minutes for the honorable ministers and the heads of delegations to come back into the room. In the meantime, I would suggest that we all stand up because, you know, my physical education teacher used to tell us that if you do not use it, you lose it. You need to stand up, stretch a little bit, feel that you are still alive after a very heavy lunch, and then sitting and more sitting. So we need to use those muscles. Please, can you stand up from your seat? It's good for you. You can speak with the next person. Stretch your arms, stretch your legs a little bit whilst we wait for the others to come back into the room. Thank you very much.